Right, welcome to Partner Spotlight. Now, to just begin with, just to give our viewers a bit of an overview, like just give us an overview of the eDoctor, the operation basically.
eDoctor was launched in 2012 with the idea of connecting people to doctors, because in Sri Lanka there was no system like that, but which was used in other countries. So I came up with this idea of how to connect a GP to a person who needs an initial medical advice. So that is how the eDoctor was launched, with a website called www.eDoctor.lk and our hotline 0115 247 000, where a person can call, chat or email a doctor.
Right now, eDoctor has been in operation since 2012, right? So, what is the feedback been from clients basically? How have they felt the services?
The feedback has been pretty good. We have, over the last 2.5 years, we have people just using the email service and asking questions is tremendous. Because of that, we have started our call center beginning of this year. We have launched 24/7 call center, where we have a call center agent with a doctor available to speak to our services. Basically, our subscribers speak to our doctor anytime. And with that, we have launched our platinum card membership as well, which is the card. And what we are offering is a telemedicine service. Telemedicine has been available in European countries and America over 25 years. And telemedicine is where someone can speak to a doctor without physically going and seeing him. And what they found out is 70% of the people's problem can be resolved just phoning and asking a question.
Adding to that example, now as a doctor I know when sometimes you work, people just come to the doctor to get advice. As an example, they just come and show a report and ask to get a second opinion, or they want to know which type of doctor to consult, a specialist to consult, or they want to get a nutritional advice, or they want to know what are the tests to be done. And sometimes they come up with this drug interaction, they want to know, get some idea about some drug interactions. So these type of things you can solve without physically going and meeting a doctor. So that is how eDoctor will help here.
So this platinum card that you just showed us, what does it offer you? What does it give you? What is the whole?
With this card, what we want to make it is a more convenient for our users, our subscribers. Now, obviously, our main service is people can get themselves registered and speak to a doctor. But on top of that, we have partnered with 25 hospitals where they can take this card and get discount. I mean, we can, even Colombo, there are Navaloka, Lanka Hospital, Oasis, Hemas, and out of Colombo, hospitals like Oslo, which is Kandy, Kurunagar. There are so many hospitals we have partnered. You can get up to 30% discount from this card. As well as we have partnered with a pharmacy as well, where they can get discount and home delivery. We have partnered with few other companies where you can get an ambulance service, doctor visit into your home. So what we want to create is a one-stop shop for all your medical needs.
Right, so what is the unique service that you are offering through eDoctor?
The main service what we offer is where you can just ringing, calling in and get advice. With that, we have coupled up with this medical storage system. Medical storage system is we have actually developed two apps, one for Android and for iOS, where you can use with your normal computer. What we have done is, it is a methodically arranged medical storage system where you can store all your diagnostic card, your medication chart, past, present surgical history, and where you can enter daily, if it's necessary, your blood pressure, your blood sugar, your BMI. When you go to a doctor, when you speak to us, that information is the critical part that others don't give. So your medical file is in your hand, in your medical device, on your computer. With that, when you speak to one of our doctors, they have all your information. So,
adding to that case, now as a doctor again, I see sometimes people come to visit the doctor, they don't know their last blood pressure. They don't know their last sugar report. They don't know their last cholesterol. So with our this medical storage system, as an example, now this is our app actually. So with that, you can see that with our app, we can store all the medical records. Example, last blood pressure. So if person, now graphically, our storage system will give a description of the blood pressure. So people know what they stand, and then they can go and tell the doctor exactly, because they forget to take their reports and records and those things. And blood sugar, then BMI, everything is storage. And even their past health records like diagnosis cards, then surgery is done, and allergy especially, and also Chris vaccination. Those everything can be stored. So even when they fly overseas, even, there are people who travel frequently, there are Sri Lankans living abroad, those people even can store their own records here, and even they can access from any part of the world.
Right, so now the doctors, how do you all choose the doctors who will work with you all, who work with eDoctor? Where do you all get them? What is your process of getting the doctors in?
All the doctors who work for us is Sri Lankan registered MBBS qualified doctors. Major doctors are actually government hospital working doctors, and we basically go through an interview process. We select them, and we currently have 25 doctors working in our call center, where at any given moment, any of our members call, there's a doctor available to take the call.
What is eDoctor's plan for the next 3 to 5 years? Your ultimate plan, basically.
What we want to make is Sri Lanka the hub of health. So through this eDoctor platform, I think it creates a good opportunity where you can connect all people to doctors. And with this storage system, it will have a all medical record system. So our plan is to expand eDoctor to the South Asian countries, especially Maldives, Bangladesh, India, those countries, and even to Asia. And also we are on a process to introduce our next step, where a person can contact a specialist, and going beyond that, even to have a video conference with a specialist. Not only a local specialist, even specialist in overseas. So we will be starting that. And also in the future we will start this e-pharmacy concept with all the pharmacies and also GPs, where we have our GP system and also the hospital system, where all the hospitals and GPs will be linked with pharmacies and labs. So it's mainly a paperless work.
Thank you very much for joining us then.
Thank you.